Hello, my name is Lauren Bontrager. As most of you know, I was Lauren Brown. However, this weekend I did get married, so there is a name change. Today I will be discussing whether or not healthcare should be free to everyone in the United States. While free healthcare may seem like a great idea and have no concern at all, we must all think of some of the pros and cons that will arise from this. Most of you in here may not realize this, but according to usdebtclock.org, the United States national debt has reached its utmost highest at $14.5 trillion. A free healthcare system seems like a great idea, but some of these things will also lead to an increase in debt, an increase in our taxes, an increase in regulation, and of course, more change. To support my argument today, I will be introducing some of the pros and cons of what a free healthcare system will bring and the future that it'll lead us to. The problem with today's government is that they usually only release to us the information that we as Americans would like to hear. According to an article done by Robert Longley on About.com, everyone, no matter the age or ethnicity, will have a free healthcare system with no consequences. It also states that the nationalized healthcare system will reduce American-made consumer products. The United States will earn money because products from countries that have a nationalized healthcare system apparently tend to cost less. Another thing that the United States government will tell us is that the United States will compete better in a global trade. Because of an increase in global trading, this should lead to more jobs that are readily available for anyone. The problem is that a lot of us overlook and just hear the words that the government says, and we're not reading the fine print. I believe that more people would oppose a free health care if they actually knew the hidden consequences that it would bring. Since nothing is ever free in the government, we would have to pay somewhere. The first thing that would be increased is going to be our taxes. Taxes will sky high through the roof. The second thing that will happen is, even though there will be more consumer products, the pricing of those products will increase because the government has to make a profit somehow. And the third thing is that our Social Security and our Medicare will both be depleted by this. According to President Obama, 80% of Americans have given approval towards a balanced approach of different revenues and certain cuts. However, I do not believe that Americans have approved a cut in their Medicare and their Social Security and what they actually are planning on keeping when they do retire. Overall, the quality of health care will be decreased by a free healthcare system. Any nurses, physicians, medical staff, all of us will be overworked, underpaid, and just living a crazy-filled lifestyle because of the certain government regulations that will be arisen. And of course, if you thought that there were longer wait times right now at the doctor's office, all of that will be increased because now anyone can feel free to use the doctor whenever they'd like. According to the Census Bureau data, 25% of the population in the United States are non-American citizens. Therefore, with our tax increase and Social Security depleting, we will be helping paying for those people. The Civil Rights Act of 1968 states that the federal law stated that all patients seeking care in a hospital emergency room must be given a minimum level of treatment, regardless of their ability to pay or health insurance status. Therefore, that 25% can still go and use those facilities. By opposing a free healthcare system, I believe we can start to rebuild our country and our national debt. Clearly, in my opinion, the government's hand in a free healthcare is far from free. So while the news media may tell us how wonderful a free healthcare system is, the paperwork on the table is stating something differently. And I want to ask you guys this. If the national healthcare free system is such a great plan, then why is Congress exempting themselves from it? With this information that I've provided today, I encourage you guys to take a second look at the free healthcare system and see what's at hand, see the causes and the effects that will take place from this. And finally, I would like to end this with a note from our little friend, the cartoon character Maxine. Let me get this straight. We're going to be gifted with a healthcare system plan that we're forced to purchase and fined if we don't, which purportedly covers at least 10 million people without adding a single new doctor, but provides for 16,000 new IRS agents, written by a committee whose chairman says he doesn't understand it, passed by a Congress that didn't read it but exempted themselves from it, and signed by a president who smokes, with funding administered by a Treasury chief who didn't pay taxes, for which we will be forced to be taxed for 4 years before receiving any benefits that take effect from this, and by a government which has already bankrupted our Social Security and Medicare, all to be overseen by a Surgeon General who is obese and financed by a country that is broke. What could possibly go wrong?